I am optimistic that the broad strength of American academic medicine can be brought to bear to make a difference. American academic medicine has become the envy of the world. It's also the envy of the world in medical research. Some of the greatest discoveries made in modern medicine to understand life and health and disease have come from academic medicine in America, and yet we have learned that this wonderful system has some shortcomings and some things that just need to change. And the question is, when the country itself is becoming more diverse, are we having more representation in leadership, in faculty? Are we having more and more representation in those aspiring to a medical career? And the answer, sadly, is no, not enough. Not enough by far. So the Association of American Medical Colleges decided roughly a year ago to go on a journey of creating a new strategic plan for the organization and for academic medicine in general. And we started with an environmental scan. And this environmental scan showed us what we already knew and really should have been dealing with more effectively, and that is the tremendous disparities and inequities in healthcare. The social determinants of health, where one lives, whether one has access to healthy food, whether one has access to healthcare through health insurance, all of these things we knew about, and I'll take the responsibility on myself and my generation. We knew about this, but we did not get the job done in solving them. So we decided to develop a new strategic plan, and we started out the plan by rethinking what has been the traditional tripartite mission of academic medicine that we've known for generations: education, patient care, and research. And in thinking about the problems we're facing, and in thinking about the results of the environmental scan, we realized that we had to add a fourth pillar, if you will, a fourth leg to the stool. We added community collaborations, where we're working with our colleagues in the community, listening to them, and making sure that their voices are among the important voices in making the changes that we so sorely need to make. As the strategic planning process moved along, of course, the pandemic struck. And we found that the pandemic, as we have learned, unfortunately and tragically, has uncovered those inequities and those disparities and put them in bold relief. As the risks of acquiring COVID and being hospitalized for COVID and dying of COVID are much, much higher in the African American community, in the Latinx community, and in the Native American community as well. So if anything, the presence of the pandemic steeled our resolve to deal with these problems. We need to make diversity, equity, and inclusion critical to our forward motion to solve many of our problems for two reasons. One is that it's the right thing to do, a social justice reason. And the second reason is diverse teams, diverse groups of people, it's been shown convincingly by research, make better decisions. They bring a broader range of perspectives to a problem. Now, this is obviously a bold, broad plan, very ambitious. Why would you think that AAMC would be the organization to tackle these myriad problems? There is no other national organization that combines the wisdom of medical schools with the wisdom and service of teaching hospitals and health systems, with the wisdom of discovery of academic societies and researchers and communities themselves, and brings it all together in one place. So we believe we are the right organization to do it. We know this is the right time to do it. We know we can't wait any further. We can't allow the problems that we're facing to take any more lives and to cause any more disparities. It's time that we acted. It's time that we acted together to realize these problems and to do something about them. That's what this is all about.